Bleeding and bruising. The following are important points that we would like to talk about in the next few minutes. There is a higher chance of bleeding and bruising with cancer treatments. Know the difference between mild and serious symptoms of bleeding and what to do about them. Some over-the-counter, prescription, and natural medicines can increase bleeding risk. Tell your cancer care team about your medicines. After your cancer therapy, you may have a higher risk of bleeding and bruising due to a decrease in platelet counts. Platelets are cells in your blood that are responsible for stopping a bleed. The lower the number of platelets in the blood, the greater your risk for bleeding and bruising. The following are mild symptoms that you may experience: infrequent nosebleeds, mild bleeding of the gums after brushing your teeth, bruising easily or unexpected bruising. If these symptoms occur frequently or bother you, let your cancer care team know. While most people experience mild symptoms, sometimes the bleeding and bruising can be serious. If you notice any of the following symptoms, get medical help right away. That means going to the hospital emergency if you cannot see a doctor immediately. Blood in the urine or red-colored urine, blood in your stool or black stools, red or brown-colored mucus when you cough, blood in your vomit or vomit that looks like coffee grounds, large amounts of bruises or purple or red dots in your skin, bleeding that is unusually heavy or will not stop, unexpected dizziness, constant headache, or changes in your vision. It is important to avoid activities that can increase your risk for bleeding and bruising. Do not play sports that involve contact or perform work in the house that puts you at risk of falls or injury. It is also important to avoid over-the-counter, prescription, or natural medicines that can increase your risk for bleeding and bruising while you are on treatment. Unless you have specific instructions from your doctor or cancer care team, avoid over-the-counter medicines that contain ibuprofen, also called Advil or Motrin, naproxen, also called Aleve, and aspirin, also called ASA. Read the ingredients in cough and cold or painkiller products carefully, as they often contain these medicines. Avoid natural medicine products such as herbal pills, medical liquids, and vitamins that are associated with a bleeding risk. These can include large doses of vitamin E, ginseng, mushroom supplements, curcumin, and omega-3 supplements. However, it is safe to eat foods that contain these ingredients. Check with your cancer care team if it is safe to use any of the over-the-counter, prescription, or natural medicines that you are taking. Some people will need to take blood thinners or are prescribed regular doses of aspirin for their other medical conditions. In these cases, you will receive specific instructions from your cancer care team. To summarize, there is a higher chance of bleeding and bruising with cancer treatments. Know the difference between mild and serious symptoms of bleeding and what to do about them. Some over-the-counter, prescription, and natural medicines can increase bleeding risk. Tell your cancer care team about your medicines.